Hello, my name is Dr. Edward Rustamzadeh. I'm a board-certified neurosurgeon, and today we're going to discuss the SI joint and the pain that radiates from it. The SI joint is the largest load-bearing joint that we have in the human body. It's located between the pelvis and the lower portion of the spine, known as the sacrum. The common complaint of a patient with SI pain is low back pain that they describe as being across their low back. It will radiate into their buttock, it will radiate down their legs. Some people will even complain of numbness and tingling. It radiates into their hip, and sometimes it radiates into their groin. Studies have shown that between 15 to 30% of patients who present with back pain will actually have SI joint pain as the source of their back pain. SI joint pain can be difficult to diagnose, so there's an algorithm that I use in my practice to help diagnose accurately patients who have SI joint pain. The first is clinical examination. On examination, we manipulate the SI joint to see if the patient has the same pain that they're complaining about. The second is to refer them for a SI joint block. And the patient again keeps a journal to evaluate whether or not they had any improvement. I always inform the patient that this is a transient, more diagnostic than therapeutic. However, it is very critical in making sure that my clinical diagnosis correlates with their outcome after an injection. So for patients who have been diagnosed with SI joint pain, I like to refer them initially for conservative treatment to see if the physical therapy will strengthen their joint ligaments. If the pain persists, we will then consider surgical options. In my patients who've been diagnosed with SI joint pain, I use a combination of navigation and iFuse technology, which uses 3D printed implants that allow for maximal surface binding of your own bone to allow for ingrowth and ongrowth of bone for fixation and fusion across the SI joint. In my studies, I found that the SI joint is a commonly overlooked pain generator. If a patient undergoes spine surgery with underlying SI joint, postoperatively, that pain can persist and even magnify. Therefore, for any patient who presents with back pain, I assess for SI joint pain in addition to any other lumbar pathology that they might have, in order to assure that the patient obtains the correct operation that will alleviate both the lumbar pain and the SI joint pain. So if you're a patient with persistent back pain and would like a comprehensive evaluation, please call our office to schedule an appointment.